If you once was diagnosed with whooping cough, can you get it again?
You certainly can get it again. Immunity does develop to pertussis, which will persist for many, many, many years. But other agents, such as parapertussis and a number of viruses, will give you a syndrome that looks very much like whooping cough. And so you can get the symptoms and signs of whooping cough again, even if you'd been infected with pertussis on the first episode.
If a baby was diagnosed, say, unfortunately, at a month of age with whooping cough, should they get the vaccine to treat whooping cough down the road?
They should get the vaccine, most especially because infants under 6 months of age do not mount a complete immune response to the whooping cough bacteria, and therefore vaccination will help continue to protect that baby beyond that primary infection.